have this month's Career Spotlight with Tamala Fulton, and I'm excited for her to share more about her career journey with us. And later, I'll let you know when we met each other. So we've known each other for several years. But for right now, I'm going to stop and ask Tamala if she would introduce herself and let us know what she does today.
Okay. Hello, everyone. I'm Tamala Fulton, and I am the Employee Wellness Coordinator for Chatham County Government, which is in Savannah, Georgia. So my role is to provide programming and health initiatives for our employees to become healthier. So I'm not in the private sector. I'm actually with the local government.
That's awesome. And I find that exciting too, because sometimes I've had guests that were in the private sector. So to hear from someone in government, I think is very interesting. So we can hear more about what you do and maybe how that's a little different from the private sector as well.
Sure. So day to day, it kind of varies for me, but for the most part, like I said, I'm responsible for the programming for our employees to help them become healthier. I always tend to tell them we are all healthy in some aspect of our lives, but there are some areas that we might need a little bit more improvement on. So I feel that that's my role when I'm at work. So we partner with local organizations to come in to do biometrics, health screenings, cardiovascular screenings. We have a partnership with a local dietitian that works with nutrition. We partner with a local hospital that does diabetes management. So our employees have access to all of these programs in our community. And thanks to our Board of Commissioners, they provide funding for employee health and wellness. Our Board of Commissioners are very supportive of healthy, active employees. So when we do our biometrics and those kinds of things, we're able to get aggregate information about employees, nothing specific on an individual employee, but aggregate information to say maybe this percentage of employees have high blood pressure or high cholesterol or whatever. And so then we're able to go to our Board of Commissioners and say, hey, these are some of the health conditions that are facing our employees. What are some programs that we could possibly put in place to help augment their healthcare? We're not trying to, of course, replace their relationships with their primary care physicians, but to help enhance it. Because, if we're healthy, we're more likely to come to work. Now, I'm in local government, so we're still working in the offices. I know some places are, working from home. Some of our departments may have hybrid. So some are working from home, some are, working in the office, but I am in human resources, so we are in the office. I think the other aspect or the other question you had was maybe the differences.
Yes.
And yeah, so I would say I've primarily worked in local government, so I can only talk about what I've heard about the private sector. So I'll just speak on what I know about local government. I think for us, there are, for programming and everything, we have to be more cautious, whereas maybe the private sector can be a little more lenient. Because with us in the local government, some of our funding comes from taxpayers' dollars. I myself included am a taxpayer, so we are very judicious and try to be studious in how we use our money. So there are certain things that we may want to do for our employees, but we take a step back and say, hey, is that a judicious way to use, our money? What are some other ways that some other programs that we can maybe accomplish the same goal, but it does come across as a program that's better fitting for the organization.
Oh, that's excellent. So tell us, how did you choose this career path? And did you have to make any transitions to get here?
So do I go all the way back to college, maybe, Taisha?
That's fine.
So, um, I think, sometimes when you're in college or figuring out your career journey, you may not necessarily know what you want to do per se, but then there's some others who I have friends that know exactly what they're going to do as soon as they get in college. So when I got to college, I really thought that I wanted to be going to biology and become a doctor And, pretty soon, probably by second semester freshman year, I was thinking, don't necessarily want to go the route of being a doctor, but want to stay in the healthcare areas. So talked with my advisors and got into exercise. Well, it was called exercise science back then, but exercise physiology. And so that is my undergraduate degree there. So for after college, I worked at a health and fitness center, a gym. So kind of, I wasn't personal training, but we had some activities for kids and adults and everything. So I did that for a few years. And then I decided that I wanted to go back and get my master's in public health. So I came to Savannah to pursue a degree in public health. And that was, gosh, almost 20 years ago. I'm dating myself, but yes, quite some time ago. And once I got here, I actually started working for the local health department. So got my master's in public health and started working in chronic disease prevention. I had an interest that I discovered in college that I still wanted to help people become healthier. I just didn't want to be the doctor. I didn't want to see the truly sick people. I mean, I was along the lines of, well, how can I help make them better with some condition management? Like let's exercise or let's talk about what we're eating to kind of handle those things. So here I started working with the Chatham County Health Department. And so it's really a coastal health district now. So there are about 8 counties that fall under them. And so when I first started, my focus was on chronic disease prevention, tobacco cessation, quitting smoking, and I was in the community, pretty hands-on in the community. And after a couple of years, I felt that I wanted to narrow my population a little bit, if that makes sense, because with the health department, it started covering 8 total counties. So you have residents from 8 counties. And so I wanted to kind of narrow my population so I could feel that I was having a greater impact per se. So I got the job with Chatham County government to work specifically with only county government employees. So, and I've been doing that for 14 years now. Did I think I would have been doing it for that long? I did not, but I have truly, truly enjoyed it. So I would say the transition for me was, sometimes people, instead of go from small to large, I actually went from large to small, and it has been working for me. I enjoy my fellow coworkers. It's just really rewarding to hear people say that they're participating in a certain program, or when we do biometrics, they're discovering, hey, I didn't know I was a diabetic. But not only did I find out that I'm a diabetic, here's a program that I can get into that's right here. Here's the information for it. So it's just kind of rewarding to know that the little things that we are doing as a county, we're actually impacting people's lives day to day.
That's awesome. That's awesome. So I'm excited to hear your journey and to hear what you just said. You decided, hey, I still want to help people, but I want to do it in a different way. And
Mhm.
then later in your career, you decided you like to hone in on a different population.
Mhm.
So that's fantastic. So let us know, what do you feel were maybe a few tips for your success in your career?
Um, One, I think you have to, and it's probably sounding cliche, but you have to enjoy what you're doing, and the sad thing is that I know so many people that go to work and really do not enjoy their job. And I actually feel kind of bad for them, but I really enjoy what I'm doing. So I think one of the first tips that I would recommend is to find something that you enjoy doing. Maybe it doesn't pay a lot, but you enjoy doing it, and I'm going to say, maybe the salaries in local government are not as high as the private sector, but maybe our benefits that we offer in local government are not as expensive or is not as pricey as maybe private sector. So, you kind of make those trade-offs there. So I would say definitely find what you enjoy doing. Make sure it brings out your passion. So I would say that would be my biggest tip when it comes to the career. Um, don't necessarily worry about what others think about your career, which can be hard at sometimes. I've reached the age now where I'm kind of like, well, it's okay. It doesn't really matter if you don't like it or whatever. However, 10, 20 years ago, it did matter, what other people thought, like, oh, you're doing health and wellness. What is that? So it's kind of like, okay, so I have to go through this long dissertation. So I would say, even though you find something that's passionate, everybody may not be passionate about it, but as long as you're passionate about it for your career, then I think that's going to make a big difference in your life.
That's awesome. That's awesome. So now I'll tell folks how we met each other. So you said, maybe over 20 years, you got this second degree, your master's. So we actually went to high school together.
Yes, we did.
And I just think it's amazing. I think it's amazing to be able to reconnect different times over the years and hear different career paths and see where everyone decided to go. And I think it's wonderful to share your experience with us. So I have maybe two more questions, and then I'm
Okay.
going to open it up for any final things you'd like to share with us. So what would you say for someone, you already told us to find your passion, things you really enjoy doing. So what are you most proud of regarding your career that you haven't shared with us?
I am probably most proud of the fact that I have established a reputation, I believe, amongst my coworkers that I'm trying to help them be healthier or help them be better in their lives. So I would say that is probably what I would feel is my biggest accomplishment. And I say that because an example is that when we started doing the biometric screenings and the health screenings, I, am housed in human resources. So when you tell employees, hey, we're going to have people come in and do your lab work for blood sugar and cholesterol, and it's like, oh my goodness, what is HR trying to find out about me? You can't know all of my medical information. So, it was a matter of breaking down those barriers and kind of explaining. And so I'm just really proud that through the years that when I'm sharing information or bringing new programs to our employees, they trust and believe that it's for their benefit, that I'm not trying to trick them. I'm not trying to, pull the wool over their eyes or doing anything like that. So I would say that's probably my biggest um, accomplishment and goal, and just having that trust, having that belief, knowing that when I send something out, or if you have questions. But I've had employees that have come and shared some really intimate things in relation to their health that they don't necessarily have to tell me, but they
Right.
feel, like comfortable enough with me. So yeah, I just feel like for me, it's not necessarily the numbers. I mean, we have large participation in our programs. They continue to go up every year. We have a partnership with a third party that operates a medical facility only for county employees and their spouses. And so we get new employees on, and so they have to be on our medical insurance for I think about 45 days before they can start, but they're already calling the facility like, hey, can I get some health and wellness information? So I just feel like that's just a sign of the work and the information that I'm putting out there. So yes, very excited that we have huge participation and the numbers, but for me, it's more of the trust and reputation that I've built with my fellow coworkers.
No, that's awesome. And I will say, for the field that you are in, I have heard more about that field, even more
Mhm,
over the years.
mhm.
And I think it's just very exciting and keeping the employees healthy and being connected. So I'm excited to hear that. And one of my sons actually is interested in healthcare, and that's
Awesome.
basically the same major that you had.
Yeah.
So
Mhm.
I think it's wonderful.
And there
And
are so many areas that you can honestly go into. I mean, I'm focusing on the preventive side of it. There's with public health, you can go into infectious diseases, you can be a hospital administrator. So it just kind of varies. You just kind of find your niche and you just follow it. You just kind of know what works for you. So,
that's awesome. So that was my last question. Is there any final words you like to share with us? Anything you want to cover that we didn't cover today that you think it would be good for us to know?
um, I just think pursue your passion. I think human resources is an evolving field itself, and I'm sure with many human resources departments, there are several different sectors or divisions of it. Under human resources, we have benefits division, we have compensation and compliance, we have training. So I think that once you find your niche, and human resources is growing and expanding. And so there are so many different areas as well that you could go through, even with human resources. But once you find what makes you tick, then definitely stick with it and run with it and, do your job and enjoy it. Yeah.
That's awesome. And I think your last line, what you just said, do your job and enjoy it. I mean, that's one of the key messages that I heard you share today. And I just want to thank you again for sharing your story with us, your journey, your experiences, and letting us know that there's many options in public health, there's many options in HR,
Yeah.
but do your job and love it.
Yes, absolutely. Absolutely.
That's awesome. Well, thank you again,
Thank
Tamala.
you.
We look forward to staying connected with you, and we would love to have you return again.
I would love to come back again. Thank you so much for inviting me, Kaisha. This is really nice. I'm looking forward to continuing this. And if you need me back, I will be back again.